Hello, everyone. Thank you for joining us again here today for another episode on the LLD podcast. I'm your host for today, David Brackett. I'm also the chair of the NCIHC LLD Languages of Limited Diffusion Work Group. And today it's a real honor. We get to sit down with a special guest who's also a dear friend of mine, Harold Odhiambo. Harold, thank you so much for joining us today.
Yeah, thank you so much, David.
It's a pleasure to have you here. Are you joining us from Portland today?
Yes, I'm joining you from Portland, Oregon.
Okay, excellent. How's the weather over there today?
Oh man, today I think it's pretty hot. It's there we are close to like 90, 91 degrees, so it's a pretty hot day today.
That is a pretty warm day for the Portland summer. Mm-hmm. So Harold, for those of us in the community that might not yet know you, tell us a little bit about yourself, how many languages you speak and interpret for, and how did you get started as a healthcare interpreter?
Yeah, so my name is Harold Odhiambo. I'm somebody who is originally from a country called Kenya. So I speak multiple languages, and so for me, languages has been a passion of mine ever since I was in, I would say, like probably middle school. I liked like a lot of different languages. We lived where we lived in Nairobi, so we had like neighbors who like spoke different languages and all that. So this is something that kind of just drew my passion and attention to the different languages. And also, like I remember in school, the good thing is that we're kind of encouraged to learn like a lot of different languages. And quite interestingly, that one of them that I did in high school was Hindu and Gujarati. So that was quite interesting. And it's something that I used to beat Indians in their own language. So that is something that was quite interesting. And so when you ask like how many languages, yes, I speak several languages. I mean, so like English being one of them, definitely. And then so we have a language that's kind of pretty much popular within the eastern central part of Africa, which is kind of now a little bit in West Africa, and it's going down now to the southern part of Africa, and which is Swahili. So Swahili is kind of predominant. And Swahili depends, actually, also when you talk about Swahili, depends on what part of the region of Africa that you come from. So one of the other languages also is Kinyarwanda, because a lot of them come from within the eastern part of Africa. And then the other one is Kirundi. These are people also who come from the eastern part of Africa. And then so we have other I also get to do other languages like Bajuni and Barawa. So, and then also just also different ethnic languages within Kenya. So you're looking at maybe like Luo, a little bit of Kikuyu. So comfortably would say kind of more like 6 to 7 different languages.
Wow, that is a lot. I didn't know it was that many. I knew it was a lot of languages you spoke. I didn't know it was that many. So.
Yeah. So yes, and you also asked like kind of what drew me.
How did you get started as a healthcare interpreter? Like what brought you into the profession?
Yeah. So for healthcare interpreter, so I remember like once, and this was in 2004, and I can't forget that 2004 in August. So I remember I went to one of the county clinics. And so there was somebody, actually, it was me myself, I'd gone to get a vaccine because the county, so being a county clinic. And then in the process of that, so I saw whereby, there were these patients who are struggling, to get to kind of even just pass a message across in the sense that they were asking for an appointment. And so me getting to speak, getting to hear what they speak. So then I kind of went and jumped in and stood next to this person at the reception area. And I said, no, I'm going to help you. So, and I asked, so what is it? So then this person tells me in Swahili that he wants to get an appointment, for one of the kids who's not been feeling well. So, and definitely the interesting thing about that is this person did not actually even have an appointment. So you find like a lot of countries where a lot of people come from. So you look at that is not the same way we get to do things over here in the US. So I'll give you an example, like for example, like in Africa. So, and I believe maybe most of other countries, maybe they do that. So whereby if you feel that you're not feeling well, so they normally go straight to the clinics. And a lot of them kind of use the word hospital, they call them hospitals. So they'll go to the clinic for them to be seen, which kind of, we have more of like technically what we call urgent care over here in the US now, which has kind of like really grown because this is where you can be able to get to see same-day patients. So yeah, so this particular, it was a particular mother who came in and she had the baby and everything, and she was like, she didn't know what to do, and she walked into this county clinic. It was mid-county, and she wanted the kid to be seen. So definitely me being there, able to help her, navigate and get to understand. The good thing about it is that the clinic was like really passionate enough to make sure that that this particular patient was seen, the mother's kid was seen. So, and I went in with them because so the clinic asked me, is it possible for you to then also help us because you speak the same language with this lady, So I said, yeah, that's fine. I'm going to be able to get to help you, get to see how this particular person can be helped. And yes, lo and behold, the patient was taken in, and and I would say everything proceeded on after that. So when we were done, so then that's the time then I asked myself, because then later on, the person at the reception asked me that, have you ever wanted to become an interpreter? So, and I was like, that's interesting. I'm like, I've never thought about it. I'm like, even me getting to do what I did, I'm like, I was just doing this out of my goodwill, because I saw somebody who was stranded, and I was like, So then they told me, yes, you can be able to become an interpreter. And guess what? You can be paid for the services that you do. I was like, oh, okay, that's quite interesting. So then that day when I went home, I went and looked online for some of the language services that were there. And yes, and I would say, from August 2004, yes, I've been an interpreter all the way up to now in 2025. So I've been an interpreter all the time.
For 21 years. So who would have thought that when that woman asked you that question and planted that little seed that would have led to the incredible career that you've had over the last 20 plus years?
I know, even me, I keep asking myself every time when I look at it, I'm like, man, I've done like 20 plus years of interpretation. Yeah. The good thing about this is when you enjoy what you do, when you enjoy what you do, in terms of getting to help people, it just comes as a no-brainer. Like it's something that you don't even look at. For me, you don't even look at the aspects of the monetary part of it, but is the help that you're getting to give to make definitely a better community.
Yeah, it's so true. And as you are going into so many different types of appointments and navigating different situations, different types of appointments, what kind of cultural barriers, if you can think of maybe an example, have you had to encounter and be sort of a cultural broker at times? Can you think of a situation where you had to help the medical provider staff understand there's a cultural differences or cultural nuances that are at play that may not be visible for the staff to understand?
Yeah, thanks for asking that question. So one of the interesting things you'll find sometimes is when you have a family, so you have a dad and you have a mom, or or you have a husband and wife, and they're in there with you at the appointment, maybe with their kids and things like that. So you find in most cases, a lot of this, you'll find that it's the men who want to get to speak, and sometimes maybe they're not so sure of how everything is, but because he wants to show that just 1 minute, sorry about that.
Sure.
Just because he wants to get to show that he is, the breadwinner in the house. So he wants to be the person even who's getting to talk, even if it comes to issues that is relating probably to the daughter and everything and all that. Maybe the mother wants to get to do that, but she's kind of like, holding back, whereby in a situation like that, like I remember one time a situation like that where the provider had to ask and asked, so, but why can't ask the mom that, why can't you speak? Why can't you say anything? You know, like sometimes he seems to be even struggling getting to know even the birth dates and everything. But the lady, the mother or the wife said, no, he's my husband. He's the one who has to speak, you know? So the provider kind of seemed to be a little bit frustrated. So then that's the time I had to tell them that I had to kind of like intervene and say that, you know, this is something that it's not that the mother does not want to say anything, but this is just a traditional thing. You know, this is a cultural thing that is normally practiced. So maybe it's like, this is the US and this is the way we get to do things. But so I had to let them know that you need to get to understand that when people come from certain places, it's not so natural that we kind of have that situation whereby it's the mother who's going to be doing everything and all that the way we do it over here. So that is just one example. Definitely, there could be many other different examples. Yes.
Yeah, and what is something that you would like to see, I guess, medical providers better understand when working with languages of limited diffusion? What are some of the, I guess, disconnects you see there that might not appear in other languages?
You know, so sometimes what I get to see with the medical providers is, you know, when it comes to explanation of things. So one thing that what I know is English and the language that you're getting to do the interpretation for does not match and does not go word to word. You know, there are situations whereby, so probably the provider maybe, you know, says like one or two sentences. And then when you're getting to talk about it, you kind of seem to be like maybe even giving a like 6, 7 or 8 different, you know, kind of like a long sentence. And they ask you that, are you like really sure you're talking about what I'm talking about? You know? So one thing is for them to get to understand that the languages that you're getting to do interpretation for does not really is not very compatible with English. There are times in situations whereby you even have to give examples because you really don't have the right word, or there's no actually word.
There isn't an exact word.
Mm-hmm.
Yeah, there's not a language equivalent for
yeah.
Mm-hmm. You have to explain it in like you said, an example or something like that, so that they can understand. Because our role as an interpreter is to convey the same meaning of the message, and sometimes, like you said, the actual word for word translation might not make any sense.
Mm-hmm.
Right? Yeah. And what, from putting yourself in the patient's perspective, what do you think it's like for them navigating a healthcare situation with an interpreter?
With an interpreter, I think I would say it becomes much easier getting to navigate the system, because because for example, you find that probably me, somebody who speaks English, you know, getting to navigate the system and getting to understand certain things sometimes becomes difficult. And you find a lot of the patients that I get to deal with, or you'll find a lot of the patients, a lot of them are illiterate, you know, so from situations where they've come from. Like I get to deal a lot with the refugee population. And so these are people who've come from situations whereby, you know, they lived in refugee camps and all that, and they really didn't have access to even things like phones, computers, and things like that. So when they come here, and when you have a medical interpreter who can be able to help you walk through, you know, and navigate the system, I think it becomes very much easy. It becomes very much understandable, and I would say at the end of the day, then it kind of brings like better health outcomes, you know, for the patients.
That's the goal. So just have one more question for you, Harold. As we're thinking about other interpreters that might be listening to this message, or maybe someone that's thinking about getting involved, as we know, there's always a need for more interpreters, especially languages for lesser diffusion. And what would be your message to help inspire other interpreters who might be considering getting started as an interpreter?
Yeah, for me, what I would tell, maybe people who, yes, who speak languages that are quite pretty much not common, is, you know, definitely your voice is needed there as an interpreter, because we have a lot of people who need help, regardless of whichever language that they do speak. So I'm looking at, in terms of, like having better health outcomes through the process of navigating, meaning from the time that you even apply for insurance up to the time you get it and you're getting to see the provider and many other different things. I would say this is something that really, interpretation is something that, for me, I would say, for anybody who's aspiring, it's a journey that you grow with, and it's a journey that you also get to grow with learning and understanding. It gives you even a better opportunity of getting to understand now the people that you get to see in your community, because it's not people that you get to see every day that you think they are okay. So a lot of things you get to learn through interpretation. And interpretation, I would say, it's one of the most wonderful and best things that somebody can ever do, because what I can see and what I see is that you actually help to get to change people's lives. It's just not the part of it as the better health outcomes, but when you have somebody who is healthy and is able to get to do things, so you're looking at actually this person then can go get meaningful and gainful employment for them to be able to get to help their family. This is somebody then also who can be able to go and help the kids through like schoolwork and everything and all that. I mean, interpretation is pretty big. It's wide, it's vast. It's just not for medical purposes. There are those ones like there's legal interpretation, there's schools, there's just so many different things. So whoever is aspiring to become an interpreter, I would tell you, like, hey, get on it, jump onto it, be ready to learn, be ready to understand. And one of the most important things is you being a professional person and getting to do it with so much grace and passion. It's something that would be nice.
Yeah, I love how you talked about just the ripple effect, right? Of you being able to be that bridge, and then now giving someone else the right to have a seat at the table, participate in their decisions, whether that's their healthcare or a different industry, and then that impacts their family, and then their family's family and their community, and so it continues to have a positive ripple effect, and ultimately improving people's health outcomes. So it is it's such an incredible career and incredible service that it gets to be provided. Like you said at the beginning, just so rewarding to be able to do. So for anyone listening, you heard it directly from Harold himself. Has over 20 years experience doing this. It is true, and it's such an incredible service to be able to provide to the community. So Harold, just want to take a moment to say thank you for all your many years of service, of serving the community. I know you volunteer a lot as well in the refugee community. I see you at a lot of events, and it's just, you really live it and breathe service and language access every day. So thank you from all of us at NCIHC for all that you do to help elevate our profession and to really help serve the community.
Yeah, thank you so much. Thank you for having me. Thank you.
Yeah, it's a pleasure.